Morning. Oh, sorry. Good afternoon, everybody. Thank you for coming. I'm Rachel Seward. I'm the Deputy CEO of WACOSS and I'm your MC for today. Before we start, I would like to acknowledge and pay my respects to the Whadjuk people of the Whadjuk people of the Noongar Nation, pay respects to elders past, present and emerging, and acknowledge that in this country we have a lot of unfinished business, and also that it's Bootaroo season, which is the season of the hot easterly winds, and boy are we feeling those. Today, obviously, thank you for joining us today. We're going to be talking about community sector workforce preparedness for COVID-19. We have a series of speakers for you. We have Mike Rowe from the department, Kim Brooklyn from Parkerville, Paul McDonald from Anglicare, Victoria in the wise person from the east, hopefully, Mark Cockayne from the WA Primary Health Alliance, and Mark Waite from Youth Futures. Today we'll be going through, we'll also have the opportunity to hear some answers to the questions you have given us. I understand there's facility to ask some questions online, which I can't promise we're going to get to today, but we will, I've been given to understand that hopefully we'll get some answers a bit further down the line if we can't answer them today. First off, I would like to introduce or welcome Mike Rowe, who really needs no introduction, I'm sure, to our audience. Of course, he's the Director General of the Department of Communities.
Thank you very much, Rachel. Welcome everybody. It's great to be here again, and can I just thank WACOSS for being such excellent partners in hosting this really important dialogue and briefing session with the community services sector. I'm fogging up a bit here, so I'm not looking down my nose here. I just need to shift my glasses so I can see what I'm doing. So as Rachel said, the focus of today's webinar is all about workforce preparedness for the community sector. The extended time for the border opening has provided us more time to plan and prepare, but of course we'll need to be prepared to pivot quickly as the new settings come into effect when they're announced, as we approach a higher caseload, and of course need to respond quickly and fairly dynamically as COVID starts to impact on our various workplaces and workforces. We can tell from other jurisdictions' experience that COVID will be with us for some time, and today we're really lucky that we'll be hearing from Paul McDonald on the experience of Victoria and other states and how they've responded and how they're still responding, of course, as it sort of starts to emerge in our sector and in other situations. But I just wanted to give you some assurance that Communities is here for the long haul with the sector. In partnership with WACOSS, we'll continue to make sure that we're giving you information as it comes to hand about the important things that matter for your sector. I'm very mindful of the questions that we've been asked and wanting to make sure that you get good and clear answers when we can give them. As you'd appreciate, there are still quite a few things still being resolved and considered by the state government, and as that information comes to hand, we'll make sure that you get those answers. So business continuity planning is a really critical part of the sector being prepared. I've said this a few times previously, but to be unambiguous, the state government can only do so much to assist in this space. We do expect and we hope that the sector and organisations that make up the sector are planning in earnest for business continuity arrangements, because the state government doesn't have an unlimited capacity to be able to step in and assist organisations if and when you're impacted by COVID. Notwithstanding that, we are here there to make good information available to people, to make sure that you're clear about what's going on and what's happening. As I've said, there's no doubt questions are still outstanding at the moment that we aren't able to answer today. But as I said, we'll continue to make sure that we can get that information to you as best we can. So it's great that we've got speakers from various organisations today to share their own insights and experiences. And again, Rachel, I just thank you very much for joining with us in this important conversation, and back to you.
Thank you. Thanks, Mike. I've just got a few comments and then I'm going to hand over to Kim. From our perspective, first off, I just want to outline that we're not talking about RATs, PPE and cleaning today. We know those are really, really important, and I know the sector and WACOSS is talking to government and pursuing those issues. We know they're vitally important. We know they're important for the workforce, but there's certain things we can't get answers to just yet. So that's why we particularly aren't talking about those today. We're talking about workforce overall preparedness, and we will certainly get back to you very quickly, well, as soon as we know more around rats and PPE and cleaning and those sorts of things. There's a couple of things that we are very aware of, and that is we know there's no cavalry coming over the hill, that the sector needs to be prepared, and we've got a little bit more time to get prepared for what we know from experience from the eastern states is going to be with us pretty soon. There is no surge workforce, so we need to make sure that we're organising our workforce in a way that we can deal with the issues around furloughed staff. And we're going to be hearing more about that from Paul. We know that we need to be flexible in terms of our workforce and responsive. We know that we need to have, and this is an ask for the department and for other departments, and that is we need constant communication with the government. We need to be taking stock takes and looking at what are the services we're providing and as a sector, and what are those critical elements. And we know that we need resources, and we have on our WACOSS website, and I think there should be a slide going up that shows the WACOSS website details. There it is, where we are putting as many resources as we can find. And at the end of the speakers, we're going to put up some slides to show you in a bit more detail the resources that WACOSS has collected to date. We're not saying it's got everything, and we'll continue to work on those resources. And as I said, I'll take you through those resources. And we know that business continuity planning is essential, and you'll be learning more about that through this webinar. I would now like to hand over to Kim Brooklyn, who's the CEO of Parkerville Children and Youth Care, which I'm sure most of our participants know. But Kim, I'll hand over to you.
Thank you so much. Hi to everybody online. It's great to be able to talk to you, and we're about to share with you some information that we're really happy to share with everybody, and we'll make anything available that we can if it makes a difference for other people. If I can just move to the next slide. So I would also like to pay our respects to the Whadjuk people of Noongar Nation, and also for all other First Nation countries that we are streaming to today, and certainly to acknowledge the elders past, present and emerging. We use our acknowledgement as a way of education, so you'll see some of the common art things down the bottom as a way of increasing people's understanding of art as a storytelling part of culture. You can just go down. As an organisation, we had been really fortunate to be able to have conversations with Paul McDonald and Victoria, and also New South Wales as part of a larger national network that I belong to. And we were able to learn an awful lot quite quickly, and we're eternally grateful for that. And out of that has come some of our planning. So we have really looking at how do we reduce the burden across the whole of organisation, and then how do we go into the more systems level and go, how do we actually help each other through what is going to be a challenging period of time. So we're really clear about what our priorities are. So supporting our people is a #1 priority, and investing in them to ensure that they have the right supports around them that makes them feel safe and makes them feel as though the organisation's got their back. And that is a really important part of what we're doing. So we're employing a nurse for 2 days a week to be our COVID response coordinator, and that will be part of a larger team, and we'll talk about the team in a minute. We've noticed that from over east, particularly New South Wales, and I think Paul also mentioned this, that having access to some sort of person with expertise makes people feel safer as well. So that's why we're doing it. We're equipping our team, and we are pre-purchasing PPE stocks, and we made the decision to do that in a proactive way, so that we could have managed at least the first 4 to 6 weeks of anything that hit us. So, and while government stocks are being looked at. Now that's our decision to do that, and it was really, again, it's around making it safe for our staff, and all of them that we've talked to about this have actually felt that that was a really important thing for us to do. Supporting our people to support people. So we're actually currently redesigning some of our services quite quickly. One of the learnings from over East has been when you've got a one-person model, so a one-carer model, if that carer goes off sick, you've got 100% of your staff out. Not particularly good in terms of risk mitigation, and so we're looking at how we can redesign some of our service models that will enable us to respond quickly, but also how to redesign some of our service models when we've got positive children or young people accessing our services, either in our 24/7 services, which are our out-of-home care or youth homelessness services. Really important thinking how to keep everybody safe and staff and clients alike. We're recognising the multiple impacts on our team. That's so important. Their mums and dads and their community members, and there are many more things than just their work persona. And in our sector, as I'm sure you'll all agree, we're not that great at self-care. We help others with it, but we're not really good at doing it for ourselves. And so we're really doing quite a significant blitz on self-care planning. And it's actually a requirement for our staff rather than an optional thing. And the other thing that we're looking at is systemic and strategic action. So how do we as a whole sector become less individualistic and become more collective as Omicron surges through the community? We can no more afford government agencies staff to be under the pressure and having low numbers as they can afford us to be the same. So how do we work together to achieve a better outcome? And that really does mean dropping egos and logos and trying to find a different way of working while we're all going to be under some form of pressure. The projections that we have is between 25 and 28% of our staff will be off at any given time, which, you know, you have to manage for that and you have to design for that. And so it just makes sense that we become a little bit more collective in how we do things. If you can go to the next slide. We've got a task force. We set up our task force probably in 2020, but we set our task force up in our out-of-home care area, not the whole of organisation. We now have a whole of organisation COVID task force, and on the back of our integrating all of our services anyway, we have got quite a clear lead in that, which is our people and culture advisor. And then we have very specific roles and tasks for each person on our task force. We are really fortunate to have lots of incredible skills and abilities in our team, and I know that I'm really fortunate in that way. And so everybody who is on this task force has a very specific contribution that they make. And so far, we've met as a whole team 3 times so far, and I can tell you some of the outcomes as we go through more of the slides. What this team does is take the pressure off everybody else in the organisation around decision making, accessing resources, dealing with things that are outside the ordinary, which we've already had to deal with, and really, again, it's helping the organisation understand, and the people in the organisation understand that we are here to kind of back them and certainly make the front line's job as easy as it possibly can under pressure. I think on the next slide. I'm aware that I'm going through things fairly quickly. We have some risk zones. We have 3 clear risk zones, or 4 actually. We have white, blue, orange and red, or yellow and red. And we have some very, very clear expectations from our staff around behaviours for each of those zones. And each of our zones have been then used in our business continuity plans for all the different services, because we've got different needs in each of our services. There's not one blanket business continuity plan that would work particularly well. So these are critical, and our zones are actually determined by public health orders, but also as a result of our appetite for risk, where we become more and more numbers in the community. So the white zone is in conjunction with public health orders. So if it's the white zone, and if then people are in an area that have to wear masks, they have to wear masks, and it's not necessarily on this list. If we can go to the next zone, which is the blue zone, which is the zone that we currently are as an organisation in the metro, and we are in Midwest, we're at a white zone. And the reason that we've had the differentiation is that we then start looking at how do we utilise our PPE. What do we start thinking about in terms of our remote work? Where do we have in-person external events? What do we do as an organisation? We are really clear around our recruitment and onboarding and what sort of practice that we'll apply at this particular stage. And it's so helpful for our managers to then go, okay, if we're in the blue zone, what's our mitigation and what's our service requirements at this particular time? It's really one of the strengths of this approach has been that our managers in doing their business continuity plans have felt that it's really clearly contained. We can go to the next one, which is the yellow zone. Yellow zone is actually when things start hotting up in the community quite a bit. If you'll see here that we're very clear about what the in-person service delivery will be and what those services actually are, and we've named them. We've done that for a number of reasons. While there might not be a shutdown as such, we will push people who can work from home so that we can redirect all of our resources to the front line. And that may be all of our PPE, it might be all of our comms, it might be anything that's going to actually help those teams that are dealing with that and supporting our clients. Anything that's going to make that easier, we can actually shift from the normal organisational sort of way of working towards them. And that, by helping people work from home, that enables us to do that. If we go to the next one, you'll see that, again, every zone there's an up in the ante in terms of requirements, extra supervision, extra support, what sort of masks and what sort of PPE need to be worn at those particular times, because we know in our 24/7 services and our youth homelessness services, for example, and also in our child advocacy and MIS services that walk alongside the police, that they will encounter positive people who are COVID positive. And so we want to equip them in the best way we possibly can to address some of that and reduce their risks as much as we can. If you go to the next slide, this is our communication plan on one slide, and the comms plan really is around what happens when and who's talked to when at different stages and underneath the different zones. You'll notice that the meetings become, they're increased, they're moved to Teams, they're moved online, and it really is about everybody being updated and having the opportunity to have a conversation about what's going on for them. Our integrated leadership team briefings are all our managers and team leaders. They are currently meeting every month, but they'll shift to every fortnight because those are the guys that are needing the information to make it easier for the frontline people. And the COVID task force at the moment, every 3 weeks, we just moved to fortnightly. And then as it gets clearer and closer, it will be fortnightly, and then it'll be an 8:30 a.m. huddle every day when it becomes quite risky, because we'll have staff who are going on furlough or going off sick, so we'll need to act with some agility. There's one point of information flow, and that's from me. So this role, so if I become, we have succession plans already in place. So if I become unwell, there's already somebody ready to come into my role. They know that they have this requirement and these actions that they have to do when they're in my role. So it's just trying to keep it really tight, really clear, and that if our team sees something from me, they know it's important, rather than the noise of email, as you can imagine. Our next one, please. We have a dashboard, a daily dashboard. At the moment, it's a weekly dashboard, and the dashboard identifies what sort of zone we are in and who are in what sort of area. As you can see on this dashboard, this was done on the 2nd of February, this one. And you'll see that we have two blue zones, and our zones are Midland and Armidale. And then we've got the white zone, which is the Midwest. As we progress into the COVID period, we'll become even more nuanced. We've got 47 different properties all over the place. So for us, you know, it makes no sense that everyone's in blue or everyone's in red if they don't have to be. So we'll become more nuanced as time goes by. The things that you'll see on this dashboard is what sort of our PPE supply levels are and where it becomes a bit more critical. We've got a whole bunch of that stuff on order, which you can see in our emerging issues section up the top. So people know that we've got stuff on order, it's on back order. We know that the recruiting for our nurse is actually getting close to being finished now, and our staff know that. Our biggest learning this week was we actually had a close contact staff member who within 24 hours turned into a casual contact. But because of the nature of his work, which was in really closed, tiny, small rooms providing counselling service, it was actually safer to push him to telehealth than was to actually retain him in his work context. So moving, that was something that we learned, and we hadn't expected that, but it was a really good learning. In the external context, there's some stuff around fair work that's changed, so we need to be really clear about the requirements around fair work and We also know that where we're doing significant change within the organisation, so for example, if we have to quickly change our staffing model, we need to also refer back to Fair Work, regardless whether it's COVID times or not, to be able to be agile. So far, this has been a really useful dashboard, and just at a quick glance, we can actually see where our higher risk areas actually are. There's 2 people in the organisation that have responsibility for that. That is my EA and also our service support lead, which are the 2 senior admin people in the organisation. Information goes to them, and that's their requirement, is to put it up. So there's clear role definitions around who does what. We can move to the next. Some of the areas that we're actually currently looking at is around, well, what do we need to do around our staff wellbeing? Have we increased our EAP sessions? Yes, we have. Finalising our recruitment. Identifying cost-effective online support. So we're looking at how do we, is there a relatively cheap online yoga or mindfulness thing that we can put in place regularly for our team to access. We're really clear about sharing everything. So we're sharing, and we hope that makes a difference. And we hope that if it doesn't, at least it might spark an idea for somebody else. We are planning for our staffing surge. We will believe that we will have issues, particularly in our services that are 24/7. So we're identifying core and critical activities, service model amendments to meet positive cases in the 24/7 services. We have major change clauses where we have to change a staffing model from one thing to another. How can we do that with an agile way and still meet Fair Work requirements? That is a really tricky one. If I find an answer to that, I'll let you all know, because we are going to have to be fairly agile at times. We're identifying our budget issues. We're budgeted and we're funded in one of our services to deliver a 1-person model. And that's not going to cut it if over that period. So we will certainly have some challenges there. And then we're exploring an appetite for weekly shared business continuity meetings with like services, particularly the 24/7 ones, where again, if one of us is actually struggling with staffing, then I think we need to be clever about how we help each other out over the period of time where there'll be challenges. Go to the next one. I realise I'm going through fairly quick, but I wanted to be quick because there's other people. Look, ultimately for us, thank you. We really want to transfer our learnings, and we hope an idea that we've given here helps to spark something for you. We've not done this work alone. I need to acknowledge our generous friends from across Australia in helping us with our thinking, particularly Anglicare Victoria, and you'll hear from Paul later, who is a legend, and also Anglicare New South Wales. We're very, very, very fortunate to be able to have those connections, and we hope that we've been of service to them in some small way. Special mention must go to Anglicare WA. Some of the stuff that you've seen in this presentation is based on their template, their COVID response that they very generously shared. We parkified it, we put our information into it, and we also had their permission to share it widely, and they have provided that permission. And it's just an exceptional piece of work that enabled our piece of work to be much easier. So we're very grateful. So thank you, everybody. I hope it's helped, and I'm keen to hear more.
Thanks heaps, Kim. I know that you have to rush off, but I do have one question that has come in. There'll be others that hopefully you'll take on notice for us, if that's possible. But the one that people have specifically asked is, when do you move through the zones that you've articulated?
Yes. So the public health orders help us move through the zones, to be honest. So we will not. And the decision making sits at the task force level, although I can override it if there needs to be a quick decision. So when the public health is, the numbers are increasing, so we know when they get to around about 800 a day, there's more difficulty in tracing. So we already know that. So if that's the case, then we'll move to another zone, from yellow to red, depending on the numbers. And for us, we have to have a real clear appetite around what our risk appetite is for different service type. that's a really clumsy way of saying that different service types will certainly push the button quicker for us. So we actually may at some stage, and we've thought about this, we're not really sure yet, but we may at some stage, if we have a large number of young people in our homelessness services presenting who are positive, we might push the red zone only because we'll redirect all our PPE to our staff. It won't necessarily reflect the whole of state zone, but it will definitely be what our team needs to keep them safe. So hopefully that's helpful, but that's our number one priority, whatever we can do to help our team be safe.
Thank you. Thank you very much for your time today, and I understand that you now need to slip away, so thank you.
I do.
Thanks.
Okay, see you everybody.
I'd now like to go to Paul McDonald, who's the CEO of Anglicare Victoria. And as Kim also articulated, Paul's been living this for a number of months and has a lot of experience to share. So I'll hand over to you, Paul.
Oh, thanks very much, and hi everyone. How are you going? Paul McDonald here. Number of months, 2 years, but anyway, it's going to be all right. And that's my first message. It's going to be all right. But look, I'm going to kick off. I want to acknowledge the land that I'm here on through this way, to pay my respects to the elders through this way. Wominjeka, Biladu Nanwa, Naranik, Paul McDonald, Lawik Bilok Nagao, Nagoon Gojin, Kurik Bilok Nagalik. Hello, how are you? Hope you're well. My name is Paul McDonald. I pay my respects to the elders past and present, and I thank you all for being here today. Look, it's great to talk to you. I haven't got any slides, it's just me. And I'm just going to talk to you a little bit about some observations of living through the last 2 years that we've done here in running services here in Victoria, and what that's meant and the way I've sort of needed to work and the way I work and we work here across here and coping with it. I mean, a couple of things that I will say, and I thought that was a very good question. How do you know when you go to the red zone and blue zone and the yellow zone? And we'll talk a little bit about being in the here and now. I've never got myself right the way through these 2 years, through all the COVID, when COVID hit, then through the Delta variant, and then through the Omicron variant, and through the next variant that will come our way. You don't want to be too far ahead, predicting too far ahead, nor do you want to be lagging behind. So it's a sort of a sense of certainly being in lockstep with the public health orders, with the government policy, and sometimes you can inch forward and sometimes you can hold your line. And I'll talk a little bit about that through some examples, if that would be helpful. And people have asked, is it a marathon or a sprint? No, it's sprinting a marathon, but you've still got, even through Delta, through, you know, the world's most locked down city at 260 or 270 days, the Delta variant that really hit our services. I'd have to say to you, the hardest part of this pandemic was the 8 weeks leading up to this Christmas. And that's saying something. And I'm even saying that something being amongst Omicron, in which we've got thousands of cases. But from the west looking at the east, it must look like, oh my God. But what I want to say to you, you're going to be all right. Okay, you're going to be all right. But here's some sort of thoughts and reflections I'm going to give you about how to be all right through some, you know, sort of the experiences that we've lived through here. And the organisation I'm looking after, you know, knowing that there's so many through WACOSS in a range of different organisations. I have 30 residential units. I've got about 400 children in under different foster and kinship arrangements under our care. Got about 1,000 staff in different family homes right across Victoria working with families. Then we've got counsellors, financial counsellors. So I try just to say, not to show but to say from an operational point of view, I'm going to cover some stuff that both covers the 24/7 and also your day-to-day welfare operation, community service operation. Look, the first thing I'd have to say, and with the people on screen, is our hand in hand, step in step with the department has been so important right the way through this. You know, I know, you know, knocking around, I did 12 years in government as well, and just knocking around, you can talk about partnership and things. Oh, is this partnership or not? But it's truly quite seriously here in Victoria, not only the relationship, but sort of the thinking and the collective action has been collectively between the sector and the department. The department has gone off and got those things from Treasury, have funded us to clean our houses at the height of Delta every day, clean our resi units, have funded us to actually provide extra leave for any staff member who need to. Back in the PCR days, took 3 days to get a PCR, or back in relation to COVID leave, furloughing a further 2 weeks of leave. Those sort of things. The partnership, it has been very important, to the point where I'd describe it like this. My conversations over the years in government have been more about the future than the here and now. A bit about the here and now, but we're doing next. Most of my conversations with government, the meetings that we have with government, are very much about the here and now, and less about the future, because it has been here in the East Coast so unpredictable, in the sense of, you know, several times we're coming back out, and that was a 2020 Christmas message from the Premier. It's going to be the best summer of all time. That was 2 years ago, and we're still in some sort of feeling. So in a sense, when we talk about marathon, it sounds like it's a finishing line. I don't think we're in a finishing line. I think it's about your ability to work with the here and now, with your environment, and continue to make decisions actively in your environment that respond to the different changes you're seeing. Now, you could be daunted and saying, well, when are we getting out of this thing? But we don't talk about getting out, or we made it, or I'm still, you know, we got through it. It's more like how you actually equip yourselves to manage your weekly, your operationals, your day-to-day as you need to. And there's only some adjustments you need to do. That some of your decision-making will be more regular, will be more active, and should respond to the environment that you are seeing around you. You know, you're in a good position, much like computer software. You want to be, you know, you don't want to be the first one off the rank. You want to be, you know, 2.14. And fortunately, you're going to benefit from how the East Coast has responded. So here's some things, apart from, or along with the important relationship that we had with government, and government was responsive with some budget support to the issues that the different services and community services faced. We've also put together things like CERSI, which is a positive, you know, within residential units, in which government funded COVID-specific care for young people or children with COVID inside the residential unit. Now, that was very important for Delta. But I must say, I can tell you, I've got 14 staff who are COVID positive at the moment. I've got 8 kids in residential care COVID positive. You know, the joint isn't falling down. I've got 6 of those in the specific facility, but we're managing 2 of those within our current residential units. Fortunately, we can continue to operate because of 7-day furloughing. Now, I know Western Australia is still in the 14-day furloughing, but fortunately, one of the biggest changes for us to operate in this environment was the change from 14 days to 7 days in the furloughing. You can manage to also get you through stuff. Now, I've got about, of the stuff, you know, at any one time, I think I had about 20% on furlough at any one time, particularly leading into Christmas during the Delta outbreak. Omicron, because it's gone to 7 days, has allowed us that furloughing to almost reach through. But here's my one point. If you feel it's too early to make that decision in relation to what you're doing in Western Australia in response to the virus, make it. Call it. Is it too early? You might be sitting around saying, gee, you know, should I buy 100 laptops for my staff just in case we've got to get further? You know, here's 3 examples. I bought 200 laptops in February 2020 just because on a whim, and they all got used. I put 16 casual staff full-time on without a shift about in October 2021 because of Delta, and they're all still in full-time shifts, covering off the furloughing. If I felt that, in fact, it was too early to put my staff into PPE, I placed PPE onto the floor of those residential units. It's important that you sort of get a sense of, if it's feeling too early, maybe that's a sign it's saying to you, as certainly managers in there, you should act. I think the second thing that you may have to change the way you're approaching your management style or your management approach. You need to steer the organisation and the clients through this, particularly the staff and the organisation through this. So communication is very important. So not only the external communication, we still have a business continuity meeting in out-of-home care and family services every week with the department. the sector sit around with the departmental reps, and we'll see what's happening this week or what's happening with trends and data. So this regularity of talking with the department at levels is important. Internally, talking with your staff is important. Particularly, I know the anxiety and the levels of worry are reasonably high in Western Australia, but don't underestimate the ability just to talk and hear those concerns and what that does. Now, my staff were very concerned in residential care back in 2020 about, contracted kids were running in and out. They weren't in PPE, but just putting PPE into the office and saying it's there if you want it, brought down the level, calmed everyone down. Oh, I can pick it up. So it's important that not necessarily, though you're hearing anxieties and this is the worst thing and this is, this is terrible, we're very anxious, talking through and having regular spots. So I'll meet with my directors twice a week during the higher times, not all the time. I think we got about, even though we've got 10,000 cases and here in Victoria every day, we're going to level off and probably meet every fortnight. We think we're getting in stride, but you up and down those meetings as you see the next new thing coming through. Is it Omicron? Is it about the new vaccine? Is it a new public health order? Bring them all together, talk about it. Is it the booster? Will we become a mandated booster agency? Those sort of things are active and accommodate. They're not just, I can squeeze that meeting in. Allow yourself time to have those meetings and discussions regularly in relation to your staff. I think it's also, I'd like you to think when we talk about trends and data, I was answering, don't play this too far ahead. That sounded, Parkerville put up, I think they're great slides just to prompt your thinking, but then act and react to the environment around you. Now, you might be in a stage where Omicron, and certainly if you're on the East Coast, the difference between Omicron and Delta are quite significant. A number of our younger staff are getting Omicron because of their socialising and things like this. And a number of our, but one of our big things that we were dealing with is Delta inside our residential care units before Christmas and how we responded to that environment. We ramped up, we placed PPE onto all of our staff. Now, the reason why I did that was purely about keeping them safe, but secondly, about limiting my exposure to furlough, because at the time it was 14 days. And if I had them in full PPE, then that ensured that they wouldn't be seen as a close contact as it was defined here. But you don't want to last that forever. You want to keep on touching base. You want to be reviewing those decisions probably weekly, not where, put all the gowns on. We don't have gowns on. We do have masks in our residential care units, but we haven't got the full kit and only in places where we're looking after COVID positive young people. So don't play too far ahead. We don't predict. I've never predicted, what 22. We can't predict what 22 is all about, but you still can manage and operate your organisation, keep the morale going, keep the contact going. The further point that I will say is that central point of communication internally, create that so that staff can look upon that. In relation to supporting your staff, sure, treat them and support them, but I think. I will say with all the lockdowns, all the Delta, all the Omicron we've had in this state, all the health disasters, not one staff member has not walked onto a shift and says, I'm here to work. Your staff are just fantastic. So treat them, look after them, recognise them, get them through, make yourself available to them, and talk your way through it. Look, an organisation here is about, there's about 70 staff meetings or something like that, who knows. But I've managed to attend 3 waves of those, each staff meeting, just to talk and listen and hear what's going on. So be prepared as an organisation to make those calls and make those decisions. But don't, interrogate the worry. When someone says, oh, it's all going to shit here. Well, 3 kids over there, but the other 10 are okay. Okay, we've got 3 kids there. Those sort of things are important, that you actually not only hear the concern, but you actually find out where the actuals are as well.
Paul,
I'd like to,
Paul,
yeah, go on, sorry.
Can you, I'm just thinking of time. Are you able
Yep.
to give us your final messages and wrap up? And because I know you're also going to be available for questions after as well.
Okay, all right. So my final rep is some people have said, how's been your plan? How did you get through this? How did you get all this agency through this, Paul? How have you kept on delivering services and delivered positive services? And I'm going to tell you this. We made it up as we go. We made it up as we went. We acted and reacted to the environment around us, and then we made the decision. Okay? It's good to have plans and things like this, but in fact, actually, you can get yourselves organised, but have confidence in your ability to actually make decisions and respond to the here and now. Your staff will actually thank you for it, and you'll be actually, one can't get ahead of this virus, but at least you'll be on pace with this virus. Thanks.
Thank you, and sorry to have to jump in.
No, I understand.
Certain people will have questions. We may not get to all of them, but would you be okay if we also put some to you on notice?
Be happy to. Be very happy to.
We'll get to questions shortly. Can I now please invite Mike Cockayne, who's the General Manager of Commission Services for the WA Primary Health Alliance, to share his tell us where the work they've been doing and also outline the resources that WAFA has available.
Thanks very much, Rachel. Paul, I could have kept listening to you for the next hour. So, and I think it just demonstrates the power of story and listening to other people's experiences as well. And I think for us, in terms of our engagement with other primary health networks across Australia and just listening to what's going on has been incredibly important in terms of our learning and directing us as well in terms of the resources. Thanks for the invitation, Rachel, and hello to everyone. Look, it has been, I've been blown away actually by the two presenters first off. I think just the work that Kim showed us in terms of the work of Parkerville and obviously shared and supported by Anglicare is just really best practice and fantastic. And I think lots of things that I know I've taken away from that presentation and we'll look to see how we can support some of our commission service providers and others across WA as well, just in terms of that. But listening to Paul's story and the reality of his experience firsthand and the importance of just responding in the moment. You can have plans, but responding. If we can go to the next slide, sorry. As we start, I'd also like to acknowledge the traditional custodians of the land on which we're all meeting across Western Australia here in Perth, the Whadjuk people of the Noongar Nation, and pay respects to elders past, present, and indeed all Aboriginal people amongst us here today. If we go to the next slide and then the next one. Thank you. WA Primary Health Alliance is one of 31 PHNs across Australia, and in fact, we're 3 PHNs in one here in WA. So we're quite unique because we actually have a statewide function. But just for people's awareness, just in terms of primary health networks, particularly in terms of the COVID response in the primary care setting, there are 5 things that we're focusing on outside of just the normal BAU. The first is about the development of COVID-19 positive community care and management pathways, really important. Supporting primary care from the National Medical Stockpile, and that's primarily clearly around PPE provision to general practice and others. The third then is about commissioning a home visiting service by clinicians to prevent avoidable hospitalisations and ensuring that people stay well within a community setting where possible. The fourth is about provision of up-to-date and reliable information. I think, you know, at the heart of all of this in terms of information, it's just ensuring that we know a reliable pathway in terms of accessing information, because when as Paul said, when the shit hits the fan, then ultimately we want to make sure that we're already aware of where we're going to go to for our information. We don't want to be searching for it in the moment. So reputable, up to date, really important, and providing that from our perspective, general practice and commission service providers, and also the extension of general practice respiratory clinics across WA as well. We've currently got 11. We're hoping to expand that reach across Western Australia as well. And that's a really important part of people being able to be supported within a community setting. There's more information there, and obviously these slides will be shared in terms of people being able to access the links and information there. If we can go to the next slide and then the one after that. Thank you. So in terms of, we've just put up perhaps a few key areas there that I'll talk about. The top one there is just a preparation checklist. Now, this is one that we provided to the sector quite broadly many months ago, and it really assisted our commission service providers and others just in terms of their preparations. So it went through workforce planning, PPE preparations, IT as Paul referred to, and IT is a really significant enabler for the sector as well in terms of moving to a remote environment to continue to provide access. So that document is still there. For many organisations, they will have already been through it, but for some who haven't, it just provides a really comprehensive list of actions that you can take internally with your organisation. As I mentioned before, in terms of telehealth, and telehealth has been a really important enabler for so many services to maintain access for people within the community, and for a lot of our providers will continue to provide face-to-face services, which is fantastic. But telehealth has been a really important enabler as well, and we've found that probably there are a lot of guides out there. The MindSpot guide is a good one. Clearly, it's referencing in terms of mental health service provision, but it's quite generic. And I think some of the important things in terms of clinical and ethical principles associated with telehealth, but probably the most important is really about the practical application. And that is really around the preparations, whether that be technical, informing and educating the person who's actually accessing the service. So again, lots of information there. The next one then is a resource that we've developed in terms of caring for COVID positive people within your region. Now, what we've done is we've collected over the last number of months a lot of information at a local level. So this particular link in terms of our website literally is regionally, and we have gathered an enormous amount of information to support care pathways for people who are COVID positive within their communities. Now, this resource is linked through Health Pathways as well for general practice, but can be accessed by anyone within the community, and it provides a whole lot of information about GP respiratory clinics, home visiting services, testing sites, transport, after hours care and support and resources that are available, disability support, drug and alcohol, mental health, a whole range of areas. So again, very localised, and that is a resource that will continue to evolve and develop, because those pathways will continue to emerge as time goes on as well. So we'll continue to update that. The service provider frequently asked questions. For us, obviously we commission hundreds of service providers across Western Australia. So there are some very basic questions at a contract level that have been frequently asked by all of our commission service providers. So again, you can see those questions, we'll update those, but there are responses to those at a contract level, very simple and straightforward. There are then a whole lot of information, and I do want to point out in terms of Aqua and the resources they have there, and where possible linking in to that in terms of Aboriginal support services that are available. The other is really just some simple things in terms of for your staff and for community, just in terms of getting ready, and many of you will have seen these resources available as well. And that's just simply about your own preparation at home. So lots of resources. Health Pathways, and I do want to point this out because Health Pathways, whilst it's accessible to general practice and doctors in general and practice nurses, you may have those people perhaps within services, but also it's just for your awareness as well, because this resource is continually updated, literally on a daily basis, because the evidence is changing, and this is purely about the management of COVID positive people in a community setting. So things are constantly evolving, changing. This site is regularly updated and provides the most up-to-date national and state information about the management of people within a community setting, including the various escalations and how that links into the state and the home monitoring service as well. We can go to the next slide and then one more. So in terms of 5 top things, and I think we've really heard this throughout the presentations today already. The first is communicate, communicate, communicate. I don't think we can over-communicate in terms of our staff. Providing information about how the thinking of the organisation in terms of how your service will evolve and change as time goes on, as COVID continues to increase within our community, what that means for your organisation. I think we saw in the first presentation the different coding and what that might then mean at a service level is really important. But for our staff, it's really about, well, what does that mean for me on the ground? how does that change my role? What's the service going to look like? The communication plan that we saw Kim speak to in terms of Parkerville is absolutely fantastic. And I think our experience in engaging with people on the East Coast has been be really clear in terms of your own internal communication strategy. It's something that organisations, in thinking about staff and workforce and how we're going to manage them and how we're going to support people who are wanting to access our service, that seems to be the focus. But really critically, internal communication plans and how people are communicated to, supported internally, really important. Second one, communicating with clients. And I think, again, at the moment, and no doubt for many service providers have probably already been doing this, but the importance of explaining to people now what they can expect as time goes on from you as a service provider, what the service will look like, how it will change, what it means in terms of can they still access a face-to-face service or will it be remote? If it's remote, how do they access it? What will that look like? If they can access it face-to-face, what do they need to do to still access a face-to-face service? So just communicating with people and providing that information. From our perspective, talking with your contract manager, and it doesn't matter where your contract's from, whether it's Department of Communities, WA Health, WA Primary Health Alliance, it doesn't matter, Mental Health Commission, that relationship with your contract manager is pivotal. So for us, it is truly about a relationship. We want to support all our commission service providers throughout this, as we have over the last number of years. So again, just being upfront, constantly communicating. If you feel there's any risk of disruption or you have needs in terms of resources, reach out, call out, really important, because there may be things that we can do in support of you and your organisation. Resource management planning, and that's probably been covered. But again, consider your workforce. It's clearly the most important thing. There are various ways that organisations have already structured themselves in terms of A and B teams and various other ways. And Paul's spoken to what he did in terms of investing upfront in resources in support of what would be a significant hit to his workforce. So considering that and then testing those plans. Staying abreast of information, and I think that is really important, but we can't know everything. It is rapidly changing. We can't know everything, and I think one of the, probably my last thing is, it doesn't matter who I engage with. It doesn't matter whether it's doctors, service providers, everyone has a need for information. And the thing that's probably been impressed upon me over the last number of weeks is how some people know bits, but no one knows the whole story, and we all know bits of the story. And I think we have it's a really important obligation we have in terms of continuing to pass on the information so that people have a fuller understanding of what the actual story is, how they access services, how they can stay safe themselves. And I think we have an obligation, obviously, in terms of sharing that information, not just with our own staff through our organisations, family, friends, and into the community as well, because it is changing. We're in a fortunate position where we get to talk about this, we engage in these type of environments, but sharing the information outside of our sectors is really critical. That's all. Thank you. I'll hand back to you, Rachel. Thank you. Just on mute, Rachel.
Sorry, it's always the case, isn't it? You always have to say you're on mute in anything that's online. So thank you very much, Mark. And now I'd like to hand over to another Mark Waite, who's going to, from Youth Futures, CEO of Youth Futures, who's going to share his very recent experience.
Okay, thank you very much. So first of all, I'll probably reiterate some of the points that were said previously. Having policy and diagrams and flowcharts are all great and wonderful, but they don't help with every situation, and you can't plan for every scenario. So from my experience, the important thing is to deal with the situation. Now, our situation involved our staff attended first aid training. So we actually had split up a number of our sites. So we had 4 different locations to keep the sites, I guess, separated. And they were wearing masks, abiding by all the recommendations. And on the evening of the 27th, we received notification from a staff member who, all of our staff have been instructed if they become close contacts or positive or anything like that to let us know. So that evening, we were notified a staff member that attended one of the first aid groups had been identified as a close contact and basically was awaiting the results of the test. So that's one thing that the policies don't allow for is after hours. What do you do after hours? You know, if you've got somebody that's on call, the important thing for us was having access to all of the staff's personal contact details to be able to provide them with information after hours and contact them and provide them with instructions for the following day. So we decided that it was really important to react straight away, go early, prevent and so forth. So that evening we contacted all of the staff who were also due to attend further training the following day and asked them to attend their regular place of work and to isolate and wait there until we found out more and we got the results. So, you know, that way it would contain the possible spread or transmission within our organisation. The following day, on the 28th, we received notification from that staff member at about 11:30 a.m. in the morning that he was a confirmed positive case. So basically 4 minutes later, we contacted the public health operations and said, this is a scenario. We've had over 20 staff attend first aid. One of the participants has come back as a positive case. What would you like us to do? Now, this is where it was a little bit frustrating because we phoned them at 11:34. It took 2 follow-up phone calls and roughly about an hour and 45 minutes before we actually got direction as to what they wanted us to do. So it was a little bit difficult to try and find the right person to talk to. And I think, and this is again just my view, the system seems to be designed around dealing with individuals rather than organisations. So when we contacted them, we were technically the first organisation that was going to be affected by a positive case in a confined environment as opposed to a public location and so forth. So basically, once we finally got a hold of the correct person, they informed us that the staff needed to go and get tested and isolate. And the point's been raised before, communicate, communicate, communicate. It's really important that you provide clear, concise, correct instructions and directions to your staff and make decisions. I think that will alleviate some of the fear and concern that they have, particularly when they're facing the possibility of being exposed to COVID. So we found that that was really important. Now, the other thing that we found was really important is we told all the staff, we provided them with information that they needed to tell the testers when they went to get tested, that they all needed to say that they were at this event, they were identified as being with a close contact, well, somebody who had been tested positive, and they were therefore classified as close contacts and would then need to isolate for those 14 days. The interesting thing was, I don't think all of the staff provided all the correct information, and as a result, were told varying things at the testing section. So some were told, you know, just wait until your test results are back. Some were said, you know, do this test today, come back in 5 days. And others were told 6 days, 7 days, and so forth. So when we saw that, we sort of took control of the situation, did communicate with the Public Health Operations Department, and basically reinforced all the staff that they were to get tested now. They would get tested between 5 and 7 days to notify us of that result. They were then also required to isolate at this point in time for 14 days, which was the requirement. We did communicate with them regularly, lots of text after hours, during the day, and so forth. So we found that that was really important. One thing that we did also that took a bit of time was to collect all of those staff members' personal details, and then with their approval provide those to the tracing unit to be able to make sure that they had all the correct information and that they knew exactly who was at this first aid training and who that they needed to contact, and then anyone else that they'd been involved with across the organisation after the training and so forth. So that did take a little bit of time, and if you're dealing with the situation after hours, it takes a bit of time to log into your systems, find everyone's file, or go through the personnel files, get all of these details and so forth. So my advice would be, if you can, have your staff's contact details, their private mobile numbers and email addresses, because the screening unit does and tracing unit do like emails as well. So have all of that handy and available. That made a big difference once we had all of that, and then they could be, I guess, treated as a collective group. The other point that's also been raised previously is to have that one point of contact that provides all the information, collection and dissemination of that information. Somebody who really can take control of the situation. So a couple of things we did is that as soon as the staff member had been identified as positive, we did tell all the staff that not to provide any updates on social media or all of those sorts of bits and pieces at this point in time. We would send out information. So we controlled that flow of information to ensure what went out was accurate. There was no misinformation and so forth. And the staff all respected that.
Oops, looks like, Mark, are you still there? Sounds like we've lost Mark. I'll just give him a couple of seconds to see if we can get him back. If not, what I might do, because I am very aware of time, is just go through the slides I was going to quickly show when Mark finished before we go to questions, to show you some of the resources that WACOSS is collecting and making available on the website. So you'll have seen from the slide I put up earlier that we have a specific area dedicated on our...
Just a quick thing, it seems like the presentation has stopped. There's no attendees. It all just disconnected everyone. So it must have been a timed out. Have you got to set a time limit on the meeting?
Let me just check with...
Oh, people are coming back on now.
Okay. Are we...
Okay, I think everyone's back on. I can continue.
Okay.
Yep.
Yeah, if you could continue, but then we'll wrap up and go to questions.
Cool.
Yeah.
Okay, so I think I was saying before that it's really important to have that one point of contact who really takes control of the situation. As a point that was raised before, don't expect the government or anyone else to ride in on their horse and save the day. It really is up to you to manage the situation, to deal with the situation, and be very, very clear. We were very clear also with providing that information to all of our other staff, because obviously they were concerned that they had a fellow colleague who had tested positive to COVID, and also potential of other staff members that were exposed. We also contacted all of our funding bodies that were appropriate at this time, and with that particular site, it was the Department of Education. So we were very transparent and upfront with them. And I think that's really important, that you're transparent and upfront with all of your stakeholders, all of your staff, potential service users, and those sorts of things. Yeah, as I said before, multiple people have said that: communication, communication, communication. The other thing we did as well is we kept records of all of the communication that we had. So I've got a record of each day, the communication that went out to staff, to public health, to funders and so forth, so we could track that. And I also have a spreadsheet of all the staff, when they've been tested, when their results have come back in and so forth, and given them very clear direction as to when they need to be back on site, and also when we can have students or young people back on that site as well. So I think it's really important that you do communicate really well, be very, very transparent. There's no hidden agendas or anything like that. I think people are really relieved, and reduction in their anxiety and their fear when you do keep them up to date. We also have prepared as an organisation. I mean, we have brought a huge number of laptops. I think we had 140 come just recently. Some of those were ordered 9-10 months ago. PPE and all of those sorts of things. We've ordered them from multiple suppliers, still waiting for stuff to arrive. Obviously now in WA, we've got the flood issue, which is preventing stuff. Yeah, you can be prepared, but treating each situation individually and deal with the situation would be my advice. But you really do need to take control and be very clear. And I think that alleviates, as we said before, a bit of anxiety from your staff.
Thank you so much, Mark. Really appreciated. There's some very strong common themes coming through here through the presentations in terms of being prepared, open communication, letting people know what's going on, doing planning, but be flexible. So thank you to our speakers. I just wanted to very quickly, there's some slides coming up now that we'll go through very quickly around the resources that WACOSS is pulling together and making available on our website. The resources that were listed here are going up, and we'll keep putting resources up as we find them and as they come in. So could someone just flick through the slides? These are around workforce preparedness, PPE resources, example of plans, government resources, tools and templates. We're also going to be looking at example business continuity planning, what are the where they're available, and also where they point to where other resources are available. Next one. And there's 2 examples of business continuity plans going up, and we can make others available. One of the key messages also is let's share resources as much as possible. Can then go to, I think it's the last one, that's an example of one, and that's the website. What I'd like to do now is go to questions. As you know, we asked for some pre-prepared questions. I'm aware there's others that have been coming in, and we'll endeavour to get some answers for you on those ones. So what we did is we did get a lot of questions on RATs and PPE, and as I said, that's an issue that we know is a big issue, and will come to, and we're hoping more information will become available very soon. So I'll go through some of the pre-prepared questions, the ones that you've already sent in, and one of them was about the surge workforce. There was a large number of questions around the surge workforce, and we summed that up as people are assuming that there'll be a surge workforce coming from government, and they were asking about when it's coming and when can they apply. I think it's very clear that there won't be one coming from government, but I'd like to hand over to someone from I think I've just had an apology from DPC, but somebody from communities who could perhaps outline what they're doing about a surge workforce for the department, and let people know if there's anywhere people could at least services could get advice from.
Thanks, Rachel. Mark Burgess here. Mike's just had to step out, so I'll hold the fort while he's out for the remainder of the session. Look, I mean, Communities has looked at its own surge workforce capacity, but that is for its own communities' essential services that we need to deliver as government. So that's the backup to our essential services. As you know, we are often the provider of last resort for a number of critical services that we provide as a government department. So we have looked at the skills and abilities, particularly at the back end staff, so staff in our finance, HR, kind of corporate services staff that might have the skills and abilities to help support the front line, and have certainly done a bit of a stock take on what skills and abilities we have to be able to reinforce, and we're certainly going to look to utilise that if we need to, and hopefully we don't, but if we do, then we will look to have some capacity there to be able to provide support to those frontline critical services that communities will continue to need to deliver to the public of Western Australia as we go forward.
Okay, thank you. Next, there was a lot of questions around homelessness services. So, for example, what are the protocols for responding to rough sleepers who access drop-in services that test positive to COVID-19? How should homelessness services that have clients who regularly spend the night or drop in and out during the day plan for high caseloads in the community, given our workforce is already under significant pressure to manage the services as it is? There's homelessness services saying we can't deny service to clients, but it's also extremely difficult to regularly test our clients who are transient and therefore keep our workplace safe. So clearly there's a whole lot of questions there around homelessness services that the sector's really keen to know further about and work with the department on.
Is Tammy on? Yes, sorry. Hello, everyone. Tammy Matra here from State Welfare Incident Coordination Centre. With regard to the homelessness, with the homelessness sector, and in response to this question, SWIC is responsible for the provision of emergency accommodation. Currently, with regard to if a homeless person turns up to a service provider and they say that they're COVID positive, or they ultimately are found to be COVID positive, the arrangements for that individual will be determined by WA Health, and it'd be the service provider would need to contact WA Health if indeed that's the first point of contact that they've had. If that individual requires accommodation to be isolated, WA Health would be referring that individual, in that case, to us, and we would then arrange the self-isolation for that person, as well as the support services that go in that will be required for the individual. If indeed a rough sleeper who has had a COVID positive test presents to a drop-in service, that service should contact WA Health via the 13 COVID phone number.
Just on that one, in terms of being able to contact various agencies, in fact, the feedback we're having, and in fact we just heard from Mark and I've heard from other services, is that sometimes it's taking quite a long time for them to be able to get through. Or are there plans to ensure that there's timely access to when people ring for some advice?
So we're working daily with health and with the State Health Incident Coordination Centre to refine the pathways, the referral pathways for all vulnerable cohorts. WA Health are building their capacity to respond to their own surge workforce for contact tracing and referrals of and case management. We have the same surge capability within our call centre as well as cases increase. So I guess that comes back to our ability to surge and respond to cases as they grow. Rachel.
Okay, thank you. That's reassuring for people to know that there'll be that increased capacity for the phone call when they do have to get in contact. So thank you.
Rachel, it's Paul McDonald here, and just to put you a little insight about how to respond to COVID positive that we did on the East Coast here, if you like, homeless people who are COVID positive. So what happened was government came to some providers and said, would you stand up a COVID positive facility? And you're learning it on the run. But we ran the youth homeless COVID positive facility for the state of Victoria, and 3 other agencies ran the adult one. Now, and that was during the 2020-2021 sort of a surge that we had here in this state. And it kicked off around April 2020 through to December, where we no longer needed it. Now, but there is currently 3 target groups that do get funded for COVID positive. That is the homeless area, the children in out-of-home care. There's specific 4 houses for COVID positive children who are COVID positive, and also there's a service that we're running for the state. 80 children have been through this, and this is for parents who have ended up in ICU, in which there's no other carer, or the grandparents and the external extended family aren't in a health position to look after the children. That we've stood up a facility which Sydney did and Melbourne's done, and it was picked up over the seas in the US, of picking up and accommodating children who are part of families, but which either carer, there's not a carer to look after them because they're in ICU. And we've had about 80 children through that, which is the turnaround time about 3 or 4 days per child, babies, sibling groups of 4 or 5, whatever. So that's also an emerging group that's come through as well as we've dealt with our numbers.
Thank you, Paul. That was really helpful. I suspect there'll be people that have lots of questions. So what we might do is reach back out to you to get some more information and provide that information to people that are participating.
Be happy to. Yep.
That'd be great. Thank you very much. I'm aware that we are going to run out of time very soon. We're going to have to wrap up, but I know that there's still people that will have questions, and we will make sure that we put them on notice and get back answers as we can. This question came from the Centre for Women's Safety and Wellbeing, and that's around transportation of clients for medical reasons or to another safe location, and it's often something that falls on the staff under normal circumstances, or public services such as taxis. And they want to know, basically want to know, can you provide some clarity on what would be the process, the appropriate process to use if they've got a positive case, where would they go to advice, but also can you provide any advice now if you've got it on what would be the appropriate process?
Rachel, I'll respond to this one too, if you like. Currently, as it stands with the caseload and under the current directions, health is responsible for the transport of people who are COVID positive, and so the transportation would be under the direction of health. There is information on the government website with regard to when we go to the greater transmission and the directions that will change there. And I'd really encourage people who need to transport people or have a part of their provision is transporting people to stay abreast of the information that's on the government website.
Okay, thank you very much for that. We've also had a question around volunteers and whether volunteers delivering essential and emergency services are included as classified as essential for the purposes of provision of PPE and RATs.
Rachel, we'll have to,
yeah,
that unfortunately, obviously we don't have health here with us today, but
yeah,
that'd be something we'd have to put forward to health for their response to.
Okay, that'd be fantastic, because the volunteers are, there's concerns around how volunteers fit in terms of being classified as essential workers.
Yeah, of course. Yeah.
That'd be great, thank you. We may have time for one more set of questions, and that goes to the accommodation for COVID positive clients. And what's come into us through the question process is a big unknown factor is the ability for community service organisations to put in place effective service continuity plans, is when they're putting them in place, is whether or not there will be an expectation for them to house COVID positive patients. And this goes back to the points that Paul was making. As an example, if there's an outbreak in an FDV, women's refuge, will that workplace be expected to continue to house those clients who are COVID positive for the duration of the isolation period? There's quite a lot of other questions, but around that. But I'll ask that in general in terms of that question, because it's appropriate for other services as well. And I presume that's Tammy, that's you again. Sorry.
Yeah. No, that's okay. That's fine, Rachel. So look, again, and this has sort of come out also from the presentations earlier, which is we can have all the plans in place and what have you, and that builds our knowledge and our awareness and our understanding and our preparedness. But really, the situation and circumstances that fall out at the time is going to dictate, the response. So with regard to the way an outbreak will be managed, if anyone in the sector has specific questions which are very pertinent to their service provision, they really need to be directed to WA Health to at least get the principles that would apply in the set of circumstances that they are particularly wanting some direction on. The requirements to isolate staff and close contacts will be determined by WA Health at the time that they're notified of an outbreak. Currently, people who test positive to COVID-19 need to isolate until they are cleared by WA Health. So, and if WA Health assesses that that person does not have suitable accommodation to isolate, they'll refer them to us to coordinate the self-isolation accommodation that's required. So whether that's an individual, a family, a parent and child, whatever the individual's circumstances are. If an FDV service has a COVID positive test result, that service should contact WA Health via the 13 COVID, and then they'll provide the directions for close contacts. If I could give some assurance or reassurance to people who are online today, SWIC has actually been accommodating rough sleepers in the recent outbreaks. So we have already been activated and directed in the space for individuals, for small numbers of homeless people. And we have also been being directed to support people who are in an FDV situation, or a parent and a child. So the system is actually working now, and we are providing accommodation and support for people who are caught up, COVID positive or close contacts. It's what happens when we end up with the greater numbers of people, but I can reassure the sector that we have pre-booked accommodation that's available for us to be able to respond and support vulnerable cohorts.
Rachel, if I could just give a little bit of reassurance. I mean, we've been through several waves here, and it just gets what gets worked out. Omicron sometimes can allow a number of different things to what Delta can do, and I think the question was, should I be accommodating someone who's positive under the roof of someone who's negative? And I think that's one. First of all, you explore what's been the stand-up positive services that are available. And in out-of-home care here in this state, there was 8 beds put aside for out-of-home care. Well, we surpassed that within hours. So then we moved and shuffled people around. So my policy was, look, I'll move my client group and the staff group around to accommodate sort of where we got the positive only. Or secondly, we stood up a facility and we made it work ourselves. Our staff from labour hire, you'd be going into COVID positive, giving them the training, and we were able to recruit to that group too. Or the third group, depending on the variant and what you're allowed to do there, is that you do shuffle your way, but you quickly exhaust the specialist COVID positive services that are available. And each agency has to sort of think their way through, how do I keep my staff safe, keep the virus from preventing to be spread, but also what's manageable within my service. So it is plan for it, yes, but you find you're in scenarios in which you need to make some responses and planning over the coming weeks ahead.
Thank you. We have run out of time for the rest of the questions and the questions on chat. I'm assured that, so what's going to happen from here is that there will be a link to for this event to the web pages and to the recording of this event, the slides and the answers to date. The department's also taking the questions on chat on notice, and they'll be made available as soon as possible. And we'll certainly, heads up to the department. I'll be chasing you for those answers, as for the ones that are available. Obviously, with the rider, that the ones on rats and PPE and cleaning, where we will continue to chase. So we will chase up the answers from as soon as we can and get back to you. There is a proposal that we hold another webinar. If people are keen to participate in that, let us know. If you think that's a good idea, let us know. And also any other suggestions for any other information, what else we can do to help, please let us know. I'd like to thank all our presenters today. Thank you very much for sharing your time and your expertise. I certainly got a lot out of it. I hope those participating did. Thank you for the department for being so accessible and helping to co-hosting this webinar and getting it happening in a very short space of time. I think it's one of the things we need to be doing, of course, is being flexible in the to COVID-19, and the sector's already displaying that degree of flexibility. So that's fantastic. And let's keep sharing resources as much as possible. Thank you, everybody, for your time today. Please access the resources that are there and encourage everyone to keep sharing those resources. Thank you very much to everybody that's been involved.
Thanks, everyone. Good luck.
Thanks.